And we're
It's
doing,
snowing.
Is it snowing there?
We have a foot of snow on the ground, so it is coming your way, folks.
Thanks for the warning.
You can keep it.
No.
We'll gladly give it away.
Choice. Okay, so when I was here a couple of months ago, and a colleague of mine and I were doing a presentation about healthcare costs, and we asked if there was something that folks would like to see in the future, and when I suggested a Medicare seminar, particularly during this time of year when annual enrollment is upon us, there was a lot of vigorous head shaking, and Wendy was really good about following up with me. Now, I work with a number of people who do Medicare, and the people I work with locally, I could not get a commitment. And when I spoke to my friends Joanne and Gwen, who have this wonderful business called Boomer Health in Michigan, where they're able to help people anywhere with their Medicare questions, and ask them if they would be willing to try something new with me, hey Joan, how are you? They enthusiastically said yes. So you guys are witnessing a bold experiment here at Ringwood Library, where we are actually doing a remote session, so that we can have experts who aren't actually here in Ringwood, but who can serve Ringwood easily, to present about Medicare, and they will be able to hear the questions, although they might not hear you well enough to get the whole question. So here's what we're going to do. First of all, I'm going to introduce myself and my friends, and then we're going to go through the presentation, and then we'll have some time for Q&A. And what I ask a couple of things. Number one, does anybody here have a cell phone? Can you please make it silent? Okay, that's number one. Number two, if you wouldn't mind, there's a sign-in sheet going around. I just like to know who comes to the sessions, and if you have questions, if you would like to be contacted, let me know. If you don't want to be contacted, I won't bother you. I'm not that kind of person. So I only go where I'm wanted. So there's that. And you will also receive contact information from my friends, so that if you want their guidance, okay, when it's time to actually sign up for Medicare for yourself, you will be able to contact them. And just so you know, right up front, it doesn't cost you anything to avail yourself of their services. Okay, so this is win-win-win. All right. Okay, so any questions so far? Okay, so my name is Tracey Lawrence. Some of you know me. I am the author of the book Dementia Sucks. Okay, and I know that that's the truth, because both of my parents succumbed to dementia, and I took care of them. The book is primarily about the journey of caregiving my mom. She was under my care for 5 years. And what was interesting about my mom's case was, while it was really sad to watch her go through, it was also hysterically funny at times, because she was a very funny, demented lady. So I suggest that anybody who's got family who wants to understand what the challenges are of caregiving and the kinds of things that you need to do in order to ensure that you survive your own caregiving journey, or that people who might take care of you or someone you know will be able to make it through. It's a good read. And there are, incidentally, copies here at the library, so if you want to take them out here, you certainly may do that. I have a company called Grand Family Planning, where I help people to navigate healthcare crises. And I welcome you to visit my website. If you would like me to contact you, again, you can put it on the sign-in sheet. And what we do is we help people figure out how to navigate. So when someone gets sick, we can help them to put all the pieces together to ensure that everyone who comes to us gets the care they want and deserve. And so that's why I'm here today, because I know that people have questions. We live in a time where it's very challenging, where it's not necessarily easy to get the information. And I know from experience that figuring out what kind of Medicare one needs can be a big challenge. I'm not on Medicare myself yet, but I had to deal with it for my parents. So I get it. And that's why I asked my friends, Gwen and Joanne, to join us today to introduce you to the concepts, and so that when you have to make your selections, you will feel better informed. And if you are still confused once this presentation is over, you are welcome to contact them. So I'd like to introduce my friends, Joanne Giardini-Russell and Gwen Elberson. Joanne, you want to go first? Or
Sure, since I moved the screen. Hey, Gwen. Yeah, thanks for tuning in, everybody. So we know Tracey actually from LinkedIn. I think Gwen met her first, and then I met Tracey, and we're in Michigan, and we are buried in snow right now. And Gwen and I met a few years ago in a different Medicare agency. And long story short, we got to the point where it was sort of like, you know what, to do things the way we think should be done properly, we left to create Boomer Health Group, which is undergoing a name change right now. So we won't get into that right now, but just know it's a name change. We're kind of rebranding. But we now, fast forward, have 6 agents that are full-time that service across the country, just helping people with Medicare. And Tracey's right. It's the hardest part of Medicare is finding someone just to help with questions, because the industry, and we'll talk about this, but everybody's sort of bombarded with material and postcards and, Joe Namath on TV right now pushing Advantage plans and this and that, and you kind of don't know where to go for what's correct. So we do a lot of online. This is one of our favorite platforms, truly. Webinars are great. We are recording this, so Tracey will have copies she can disseminate as she pleases. But there's a lot of links and ways to get to us. We have chat features on our website. There's email, there's texting, there's people sitting at the phones. We've got millennials on staff. We've got Gwen and I, who would love to be on Medicare, but we're not old enough. But
speak for yourself.
Well, I'm closer than she is, but I would love to be on Medicare. So anyway, just have at it. This is your special time to get anything you want answered, and we are very candid and open. I think you'll find some of the material might be a little different than you've heard in the past. And, that's it. So we kind of live in the Medicare space and happen to enjoy it. It's kind of strange, but Gwen, give your 2 cents.
What she said, yes. Really enjoy what we do. Love the feedback that we get from people. I love it when a light bulb goes on in people's heads. And I don't know, I always liken it to algebra because that's not my favorite subject at all. When you get it, and you're so excited. You're like, oh my God, that's all it took. It just took this, and I get it now. So it's hugely rewarding and hopefully very helpful to you. And that's what we do. We just spread the Medicare love around the United States, and hopefully you find it helpful.
okay, so I'm gonna hide us the thumbnail so they can see the presentation for now.
Okay.
And we'll bring you guys back when we get towards the end. Does that sound good?
Perfect. Yeah.
Okey-doke. There we go. So you're minimized, and now we'll be able to hear you.
Okay, so here's basically loose agenda, and Tracey, feel free to interrupt with questions if you get any from anybody there. And Tracey's going to relay the questions back to us so that we can hear. But essentially, what is Medicare? Let me get a feel for who's in the audience. Are you turning 65 or people on Medicare generally, would you say?
Okay.
Anybody coming up to Medicare in the next 12 months?
Okay, so we have we have
Next 12 months.
4 people who are going to be in the next 12 months, and
Okay.
everybody else.
On.
1, 2, 3,
Okay.
5, 6, 7, 8, 9 people who are already on.
Okay, great. So I just didn't want to bore the people that are if there. Everybody was on that. So Medicare. The easiest way to think of Medicare is just think of it as health insurance. That's all it is. It's health insurance that you become eligible for when you turn 65 years old in our country. And if you think of it as health insurance, it makes life a lot easier. I think just because it's connected to the government, people have this daunting sense of it's something, very mysterious, but it's really just health insurance. It's a lot like your Blue Cross or your Anthem or Cigna, Aetna, whoever it is. You're provided the opportunity to go get this insurance through the government if you turn 65 in our country. Or if you're on Social Security disability payments for 24 months, you now get Medicare. Or a couple other situations, if you have end-stage renal disease or ALS in our country, you can have Medicare. Okay, so that's kind of the qualifiers. But basically, it's just insurance. And so we work with people, when they turn 65, the fact that you're eligible to go get this stuff doesn't mean that you necessarily should go get this stuff, right? So we spend a lot of our time comparing. I just got off the phone an hour ago with a 68-year-old. She and her husband are both 68. They're not on Medicare yet. And she said, gosh, do you think it's time we should start looking at it because we're getting this cost? And, we ran through things in 15 minutes and the answer was no. You still should defer Medicare, in my opinion. So that's what we're doing. So, that's a big thing to understand too, is just the fact that you don't have to go get it. Everybody just assumes that at 65, or you've probably heard this from people, I thought you had to go get it, or my neighbor said I have to go get it, and all that kind of stuff. And that's just not the case. So we sometimes stop people from even doing that and, purchasing a product with that, if you will. And I will say too, just, preamble is that we are an agency. We are an insurance agency that helps people with Medicare products. So that's how we are compensated with the people we work with. But case in point, the 68-year-old I talked to today, we won't work with her for a couple of years, but she just appreciated the assessment. And she's in a better place right now. So when you're turning 65, that's the key time that we say at 64 and a half is the magical zone of just have a conversation with somebody like us. It doesn't have to be us, but if it is, call and set up a consultation on the phone. But it's really, really, really important that you just kind of walk through what Medicare looks like or what it doesn't look like for you in your world, okay? Because when we catch people at age 64 and a half, we can stop a lot of the common mistakes that are made. So we like to just kind of put out there that we know that people don't really want to get a PhD in Medicare in terms of understanding everything there is to know. We know everything there is to know, but that's our job. You don't want to have our job most likely, but it's really important to then go and just talk to people that can stop you from making mistakes. And I think that's the key to Medicare is people, I don't want to know everything, but I just want to make sure I'm not screwing something up, because you can do that pretty easily. And especially, again, when you're listening to the media, to your friends, to family, to colleagues, to HR, to Social Security, all these people that don't actually have all the best information for you in terms of opinions. So it's really key to understand, because if you're going to, flip the switch with Medicare as your health insurance, you want to understand how it works. You want to understand what it's going to cover. You want to know how much it's going to cost. You want to know if you should be signing up for it. You want to know if there's an HSA contribution, how does that relate? If you have COBRA insurance, there's so many. I could sit here and list probably 30 different scenarios, and then they're all very different. So you really need to take the time, take a half hour, get a consultation, but do it at 64 and a half, just before you turn 65 and make mistakes. So on to open enrollment. This is actually called an annual election time. And what this window is for everybody out there, you see, again, Joe Namath on TV, he's talking about Advantage plans. Everybody's flashing zero premiums. Everyone's talking about free dental, things like that. But with this window right here, from December 15th until, to October 15th till December 7th, that's the window where people can change their prescription drug plans. They get a new plan for 2020, okay? The plan that worked for 2019 maybe doesn't work as it should for you in the year 2020. So right now we assess with our clients, we walk them through and we go and find the new drug plan that works for them. Now, also people that may have heard us speak or read our material, things like that, if they understand that there's, a different product available to them, we spend a lot of time educating about Medigap as one product and Medicare Advantage as a second product. And we talk a lot about that. And so a lot of times when we are speaking, we get the comment that, hey, I've been doing this for years and I didn't know Medigap existed. And I want that product instead of what I have. So during this open enrollment, it's important to know that people can make that change. So they can change from a Medicare Advantage plan if they choose, and they can go back to original Medicare with a Medigap product. They do have to go through health underwriting. So that's a big thing to consider. And we walk them through that right now. So that's a lot of our work right now. All year long, we are helping people transition from the workplace to the Medicare system, because the workplace coverage works very differently than the Medicare place. And you just need to know how to transition properly, again, without making mistakes with penalties and things like that, verification of coverage. So there's a lot going on. Open enrollment, understand that if you have a Medigap plan, somebody out there with maybe a Plan F or a Plan G or something, those are the more popular plans. If you have one of those and you ever want to consider changing carriers, just understand that that doesn't apply to open enrollment necessarily. This window right now has nothing to do with that. And so many people just think that this is the only time you can make a change with Medicare, and that's not true. Okay, so if you have a Medigap Plan F and you want to look to change it, you can do that February 1st, June 1st, September. It doesn't matter what month it is. You can do that at any time. So again, the key is right now, if you have a Medicare Advantage plan and you find that you don't care for that plan, or even want a different plan, you can change your Medicare Advantage plan right now, or you can go back to original Medicare and then get a drug plan separately. Okay. Changes changes that are happening right now in 2019 for 2020, there's a couple significant ones, mostly centered around Plan F. So Tracey, does anybody there have a Plan F in the room?
Does anyone here have Plan F? You do? Yes.
Okay. So that right there is something that's changing. So she might be aware that in 2020, that plan is going to be phased out, being sold. It's not, some people are saying, well, Plan F is going away. It's not that it's going away. It's just that it is being phased out for new consumers. So new consumers cannot purchase that plan after January 1st. So there's been a lot of questioning. Now, we've known for 5 years that Plan F was going to be phased out on January 1, but a lot of people are now kind of hearing about it. It's in the news more, and they're asking what's going to happen to their plan. Well, nothing is going to happen to your plan in terms of no one's going to take that away from you. One thing we would suggest cautionary, however, is when you look at a Plan F in terms of rates, Plan F is a great Medigap contract. It covers everything that Medicare does not cover. So it's fabulous in terms of its coverage and scope. And when you have a pool of insurance people and they're all buying Plan F and no new people are coming into that pool of product or consumers, there's a good chance we are presuming that the rates are going to go up faster for that pool of people that are holding a Plan F as in terms of coverage. So we are suggesting and would suggest that if you are insurable and you can change companies and carriers, we would suggest looking at the Plan G as in girl, and that's a Medigap contract as well. But the only difference is that the consumer would then pay a deductible, which in 2020 will be $198. So I'm going to back up too in terms of, okay, well, what is Medigap and how does it relate to Medicare? So when people have Medicare in our country, they have original Medicare with the government. We touched on that in the beginning, but that's the government, and you pay the premium to the government for your base Medicare coverage. And then when you come away with that, you have 80% coverage, not 100%. So what people do is they then turn around and they purchase either Medigap as a coverage, and this Plan F is one of those policies. So the person there has this Plan F, so that Medicare pays 80% of her bills and Plan F pays the rest. So she doesn't have any bills. And I'd be shocked to hear if she's there saying that, no, I get bills, because you shouldn't get any bills. It's terrific coverage. But again, it's going to be no longer offered to the consumer out there. Rates, we think are going to rise because of that. And then eventually, with insurance, you have to just be careful because it's a pool of claims, right? So, if you have of older folks getting, older and sicker as time goes on, rates should go up accordingly. So just be careful with that. You can get, quotes if you need from us, from anybody, but just look at that and just understand what could happen with those Plan F plans. And it depends on your carrier and such, okay? So Medigap essentially just kind of goes paired up with Medicare A and B, and you just sort of, fill the holes of what Medicare isn't going to cover. So it's great coverage, okay? So that's probably the biggest thing that's going to happen, other than the deductible is changing. It's going to be $198. This was just announced last Friday. The premium for Medicare Part B is going to $144.60. So that's changing. Some deductibles are increasing, things like that. But our job and our role is to really pair that up so that you're not going to see those deductibles or co-insurance and co-pays and things like that. So you don't have to be too concerned about the nitty-gritty other than the premiums. Understand the Plan F changes. If you have, I should point out, Medicare Advantage. So Medicare Advantage, I'll talk about what that is. In a nutshell, Medicare Advantage is your second choice in Medicare decisions. So when you come up to Medicare age and you sign up for your A and B of Medicare, you can also, instead of getting like a Plan F or a Plan G, you can just go get something called Medicare Advantage. And that's what you see advertised potentially with the zero premiums, with the dental thrown in and things like that. The premiums really, really range from $0 to $300 in our state of Michigan. But these are privately contracted managed care programs. So you need to really understand how they work and how different they are from original Medicare with the government and a Medigap policy. So again, back to Medicare Advantage, it's managed care. So what you're doing is you are basically signing up for a program that is managed by an insurance company. Tracey can tell stories of managed care potential glitches with long-term care. It's a natural fit with like a skilled nursing facility. Someone was telling me about someone that wanted to come from out of state, from South Carolina, to be here near his kids in a skilled nursing facility. Well, they couldn't find a place in Michigan to accept his insurance from down there because it was a Medicare Advantage plan. So you have to give a lot of forethought to what you enroll in for situations like that. So there's a lot of planning that does go in hand in hand with Medicare. That's our bottom point here, coordinating Medicare decisions with other planning. That could take another hour. I mean, that can seriously discuss, long-term care. How do you plan for Medicare premiums? Medicare is based on income. So some of the stuff we don't have time to get into today, but there are so many angles and pivots that Medicare is just an important liaison point for all of these decisions. So I don't know if you have anything to add here, Tracey, about long-term care, skilled nursing, and Medicare products. I'm sure you have some stories.
And it's a common misperception that Medicare will pick up the cost of long-term care expenses. And unfortunately, that isn't the case, particularly when you have issues that revolve around assistance, right? Medicare is primarily for medical issues, whereas long-term care is more about what's known as custodial care, right? It's when you need help getting around. You need help with meal preparation. You need help getting in and out of the bathroom, in and out of the shower. Those kinds of issues. Medicare does not cover that at all. So it's really important when you are considering the type of Medicare coverage you're going to select, you want to talk to a professional about long-term care coverage as well, because the likelihood that we are going to need some kind of assistance at some time in our lives is 70%. If you turn 65, you have a 70% chance of having a long-term care event in your life. So you really want to talk to somebody. I can help with those kinds of issues. And a lot of people, before they even contemplate long-term care coverage, assume that it's too expensive. The truth is, healthcare is expensive. And so what
in this country.
well, you know what? If you're not going to pay in money, you're going to pay in time, right? So, and unfortunately, there are people in a lot of countries with socialized medicine who've learned the truth of that, and they wind up, if they have the resources, flying here to get treated. So, it's unfortunately, healthcare is a business. So, what I strongly suggest is having some kind of strategy in place. And there's no one way, right? But there are a number of different ideas that can be implemented in order to provide a hedge against a major blowout in a long-term care scenario. So, any questions? Yes.
Why do insurances cover long-term care unless you pay for it separately?
If you're talking about Medicare insurance?
No, not Medicare.
Oh, yeah, okay. Well, there are lots of different long-term care options. There's a traditional long-term care policy, and it can be constructed a number of different ways. The thing that personally I don't like about those policies is that they're use it or lose it, right? You can only use it for long-term care and under certain conditions, certain qualifiers. Then there are life insurance policies that have long-term care riders attached to them. To me, those are the kinds of policies that make the most amount of sense, because if you don't have a long-term care situation, you don't have to spend the money in the policy on the long-term care. You can use it other ways. Okay, so there are, and then for people who are not in great health, there are also annuities which have long-term care riders as well. So there are multiple options to look at. It's a good idea to talk to a professional who knows this space so that you can, you get an idea of what the options are. Yes.
Why is it that, I don't know if it pertains to Medicare or whatever, but in New Jersey, you don't have a choice what to pick. If you're under the age of 65, you have to go with C. But if you're in the state of New York, you can pick any one.
I'm sorry, you can only pick C for?
If you're in the state of New Jersey.
Right.
Okay, you're under 65.
Right.
You can only pick C.
Well, if you're
Medigap Plan C, right?
Right. But
Yeah.
if you're in New
So,
York, you can pick anyone.
correct.
Yeah.
Right. Different states have different rules for handling under 65. If somebody's on disability, it's not a federally regulated set of requirements. So a carrier, any carrier can decide what they would like to sell or not to sell to somebody under age 65. When that person on disability with Medicare turns 65, they get the access to all the plans just like any other 65-year-old. But that is independently state regulated.
Okay. So if you live in the state of New Jersey, you're screwed.
well,
Yep. Yeah.
I know a lot of estate planning attorneys, and they will tell you, if you got a choice, cross the border.
Right.
It's unfortunately, New Jersey is not a great place to get sick in old age.
Yeah.
Yes.
Yeah.
Yeah, in the beginning, she mentioned certain diseases that put you under Medicare
Right.
prior to 65.
Yes.
Is Crohn's one of them?
Crohn's is not one of them. No, Crohn's, unless it's extremely advanced Crohn's, but no, Crohn's is not on any application that I can think of. They're more like things like internal, cancers, leukemias, ALS, heart disease, if you had a stent last week, Parkinson's. I mean, I can go on with the list.
Yeah.
Kidney disease, right, chronic CKD, any level of kidney disease, dialysis, of course, yeah. It's the long-term expensive things you can imagine that a carrier does not want to take on. And that could be as simple as, I had a guy called yesterday who was fishing around for new rates, but he then kind of said, well, let me tell you what happened last week. He got an elevated PSA reading. Well, so today he's having a biopsy, so he cannot be moved during that type of an episode. So it's not always something lethal or horrible, right? It could just be even a knee replacement. If you're in the middle of physical therapy, you can't move carriers because they don't want to take on the new physical therapy risk and exposure. Okay?
Thank you.
Sure. But do pay attention. So this slide right here is just really talking traditional Medicare versus Medicare Advantage, because one thing to get
Joanne,
across.
I'm sorry,
Yeah.
So we got one more. We got another question.
Okay.
Because the Medigap coverage, is it a supplementary insurance?
Yes,
The same thing.
Medigap is supplemental.
Okay.
Yes.
Yes.
It's the same thing. It's just a Medigap is just is Medigap a trade name? Or
No, it's actually, if you go back to the Medicare New Handbook from the government, it is called Medigap in there. And the reason we like to call it Medigap is just so that people understand that it's very different than Medicare Advantage. Because if we ask consumers, do you have a supplement? They all tell us yes, but they really don't know if they have Medicare Advantage or Medigap policy. And they're two different things.
Right.
So that's why I always refer to it as Medigap. Yep.
Okay. Does that help? Okay, great. Okay.
And
so,
this slide here just talks about that. You know, it just talks about traditional Medicare, and then we pair that with a Medigap plan, or you pick Medicare Advantage. You have two choices. So if you can get a couple things out of today, just understand, number one, that you have two choices, not just one. A lot of people just feel like you have one and you have to go sign up for Medicare Advantage, and that's not true.
Right.
So, and then the bottom thing truly is the long-term care angle. You know, we see this a lot. I was with someone recently who husband had a stroke in June, and she's now retired. And she said, you know, he can't be left for very long. But she said, everyone tells me just to hire somebody, but that's custodial care. This is not, he doesn't require nurses to come in all the time. He requires custodial care. So that's private pay, you know, so she's struggling with that.
right.
You just don't, it's amazing how fast it can change. And she said too, and she's right, in that if you have a car accident, especially like in Michigan, our insurance here is phenomenal for people that are injured in a car accident. That will pay for custodial care for the person's life. You know, that doesn't happen very often. But in her case, it was her husband had a stroke, you know, so it's a big thing. And, you know, we can only come back with Medicare is not going to cover that. So,
Right.
so again, you know, the whole thing is planned accordingly, but, you know, I'll go past here, but again, a lot of the assessing is coming up to 65 years old. You know, what do I do at 64 and a half? You talk to somebody. If you're still working, compare your workplace insurance. So these are for the 4 people out there that are not in the Medicare system yet. If you're working, just go to your work insurance and look at that compared to, you know, what you can have with Medicare. A lot of, do I need to sign up? This is interesting here. So this JP Morgan thing, I'm pointing to this, if you can see my cursor. This is from JP Morgan. And we see this stuff all the time in terms of misinformation. So it says, be sure to enroll during your initial enrollment period for Medicare, which is 3 months before your birthday, the month of, and then 3 months after, or you face lifetime penalties. Does that imply that everybody needs to sign up right during that window?
No.
No? You don't think so? I would think yes. I think it just sort of leads you to think you have to sign up. But you don't have to sign up. Eileen, more people think you have to sign up than don't. And it's based on just information like this. Pardon me?
Right. So this is not true then, that you can delay.
No, this is technically, right. It says, you know, or you can, it says it should be, or you may face, and that is true. So if you don't sign up for Medicare at a certain time that's proper, you may get a penalty. But let's just say somebody is working. So I want to go speed up to the other over here. You know, when you're working, I'm still working. Do I need to sign up? This is one of the questions we face every single day. And the answer is maybe. You may, you may not. So if somebody comes to us on the phone, and this is why Medicare is hard, there is no exact answer. So if they call us and they say, hey, I'm working and I want to stay working, and my employer pays all my insurance. My wife is on the insurance. You know, I'm healthy. I'm really not using my coverage very much. I'm contributing to a health savings account. And on top of all of that, I'm contributing to an HSA. And I like it. That person right there, well, I would say don't sign up for Medicare. Don't do anything. As long as somebody is not receiving Social Security benefits at age 65, they will not be enrolled automatically in Medicare. It's a conscious decision at that point to go get Medicare. But do you need it? Maybe, maybe not. So that's what we go through all the time with people. So some people are, no, I'm not contributing to an HSA. Then we would say, well, then fine, go sign up for just Medicare Part A as an apple. That's the free part. That's the hospital coverage that's just free. If you go to Medicare Part B, that's when you start getting, you pay a cost for that coverage, and then you're potentially being double insured, and you're just potentially kind of goofing yourself up for longer term decisions in terms of insurability and things. So hopefully that's clear. I know it's muddy, but hopefully that's clear. But that's what happens. This is our normal everyday conversation with people. So there is nothing automatic about Medicare. If somebody's on COBRA, the stroke person I was just talking about, we caught it because he had a stroke in June. He's 67 years old. In July, he went on COBRA insurance, and he's 67. So in our ears, what we perk up in here is like, wait, but he didn't go get Medicare. That was bad. Medicare for that person actually became primary insurance in July. He just didn't know it. She didn't know it. And she said nobody at HR told her. Well, they didn't. But guess who's going to be stuck with any bills that can come out of that? What happens is when somebody is on COBRA and over age 65, so this might apply to the 4 turning 65-year-olds, don't be on COBRA at 65 plus. Don't do it. Very, very, very infrequently is it a good move. And this person, again, he has a stroke. He goes on COBRA. He's 67. He did not go get Medicare until we just hooked it up for December 1st because I talked to her a month ago. What happens is Medicare's primary. So that insurance company truly has the right legally to kick the claims back and say, well, we're not your primary insurance company. Medicare is.
Right.
Oh, you don't have Medicare? Sorry, we're only paying 20%. You're on the hook for the 80%. So if somebody's paying really big COBRA premiums, they're not very happy when they get that news, right?
Yeah. Wow.
So there's all this muddled stuff that this is the part of Medicare that nobody seems to help with. So this is kind of our, like I said, our sweet spot, our specialty, if you will, just talking through this. And all it is a conversation. Get on the phone and talk it through, you know? So we just catch error after error after error because it's not something your financial person pays attention to because, number one, they don't know. And they shouldn't be spending their time doing this. Tracey doesn't know this stuff because this is not her zone of her workplace. It's ours.
Well, I got
right?
you guys.
HR. Well, and that's what we do. We pair up, and it's exactly the case. HR should be, you know, referring to places like us because they're not discussing this stuff. I can't tell you how many times we hear that, well, no one at HR told me that. Well, I don't know. Do they know? Do they, you know, I don't understand. I don't get it because they know your birth date, right? So if they're handing you COBRA insurance papers when you're 67 years old, there should be a flag, but there's not. But again, the only person that's hurt at the end of the day is the client, the consumer. So it's just, there's so much going on in their world with a stroke and dealing with workplace and COBRA. You know, they're not thinking about Medicare issues going along with that. They're just not.
Right. The only
Any
ones who might
questions there?
know
Because
are
I
the
know.
ones- Yeah, the ones who are actually in that that age zone themselves.
Yeah. So I know a lot of this stuff, and there's probably a dozen questions per slide, but for the sake of time, we can go through and catch some at the end. Again, we already covered this, but October 15th to December 7th, coverage starts January 1st for drug plans, for new Medicare Advantage plans. Every fall, the TV just lights up. This year has been extra bad. I don't know if everyone is catching that the way I am, but every single time I see or hear something, it just grinds me because it's the innuendos and you know, just encouraging this or that and flashing free dental. So we get a lot of people during this time coming to us like, well, wait, I have this and I don't have free silver sneakers. How come? Or I want this and I want that. So, you know, be careful what you're looking at too, and even listening to friends and family, because all your friends might be bragging about the free stuff they get, but I can tell you they're not talking about their co-pays for physical therapy. and all the things they're spending money on, right? And it's just a bad way to collect your information, you know, because your friends aren't necessarily doing the right thing, but they're not going to admit that to you, right? So it's an interesting space. They're just not. But we laugh because we know 65-year-olds are kind of hovering out and Friday night having cocktails talking about Medicare plans and comparing, you know, and everybody wants to one up, right? Well, I have silver sneakers. Why are you paying $100 for that? That's dumb. So it's a funny, like I said, it's a funny little space, but, you know, we kind of know what happens there. So, and it happens every year, but this year it's definitely worse. Something I'll point out too, why the marketing gets more and more and more. And a lot of people don't understand this, but Medicare Advantage as a program is funded by the government. So every time a person enrolls into a Medicare Advantage plan, a new 65-year-old turns the corner, they sign up for a zero premium plan so they can get some benefits, right? The government is paying the carrier that gives them that plan. They're paying them $1,500 roughly per month, every month of the year. And what they're doing is they're asking that carrier to control Mr. Jones's care, to manage his care. Government pays the money to the carrier. Carrier turns around and runs your care, right? So therefore, again, the marketing is pretty hot and heavy to get you into those plans. The carriers are making a lot of money. The carriers pay agents double the compensation for signing somebody up for a Medicare Advantage plan than they do for a Medigap contract. Okay, so they're very, very different things. And just understand, you know, that if it's that good for the government to get you into the plan, if that's good for the carrier, it's good for the agent, think a little bit about who maybe it's not the best for, right? Again, typically the consumer, right?
Yeah.
So happens all the time. Changes, we talked about Plan F, Plan C. Those are the really big things. But again, we've known about Plan F and Plan C going away or being discontinued for 5 years now. So I would just give a lot of thought to the concept if you want to stay in. If you don't want to stay in, if you want to stay because you don't want to deal with the deductible, by all means, just stay with Plan F. It's a great plan. It works really well. If you're not insurable, you know, to change, I always say, well, congratulations that you have it. I'm thrilled that you have this Plan F because it is phenomenal insurance. And, you know, if you've got something going on, you would be incurring some costs. So, you know, it's just important to understand. So many people don't even know what they have. You know, we have calendar appointments always pop up. I saw one this morning and the woman wrote to one of our advisors and she just said, I'd like to understand what I have first, which how classic is that, right? I mean, you should understand what you have, but a lot of people don't. So know what you have, you know, dig out your card, look right on your card. A lot of carriers put right at one there, Plan F, Plan C, Plan G, whatever you have. If it's a Medicare Advantage plan, it's going to say something like HMO or PPO. A good way to know if you have which one of those you have is, do you use one card when you go to the doctor and the pharmacy and everywhere you go? Or do you pull out your Medicare ID card along with your Medigap card and have a separate card for the pharmacy? So that's kind of a little trick just to figure out which one you have if you don't know, okay? This is the whole crux of everything is coordinating. So, you know, you use a firm like us to sit in the middle just to handle the Medicare thing. I think it's so smart for people to have an expert in, you know, the Medicare space. I have long championed for the financial industry to start putting in little divisions of healthcare divisions. I think it would be so smart for large firms to come up with a short-term, you know, long-term care division, a Medicare division, things like that. It's not there yet, but you've got the aging population, 11,000 people a day turning 65. Medicare is one of those things that every single person has to deal with, and it's sort of ignored to some degree. So it's amazing the lack of coordination. It's getting better because I think we're kind of pushing the envelope. People like Tracey were, you know, compounding, coordinating efforts to kind of get that message out there, but it's super important, you know? So here's another tip too. I will just tell you with Medicare, don't feel that you have to let somebody in your home to help you with Medicare. There are a fair amount of advisors out there that they're just agents that are making a lot of money on Medicare products. They're also trying to come into your home because they understand that you want Medicare help and you're looking for it. You don't know where to go, so you answer a postcard or you go to a dinner or something, and the next thing you know, they're in your kitchen talking about Medicare. Great. Once they help you with Medicare, they then pivot a conversation over to your retirement plan and annuities and such. So we see it happen. look for people that will help you with Medicare that are not doing other pieces of anything. We don't do long-term care. We don't do annuities. We don't do life insurance. We do nothing. We do Medicare, you know, sun up to sun down. But I think it's kind of catching on that you just, you know, I tell people every seminar I do, you don't need to let people in your home to help with Medicare. We are virtual. We're over the phone, and some people have an issue with that until they talk to us. It's like, well, that was pretty harmless, and they got some good information, and we don't bug them. So we're here to answer questions. So again, you're not letting us in your home at 7:30 at night. So just be very careful, because it's really catching on as an industry in terms of the money that's behind, you know, the baby boomers moving up and wealth and all that kind of stuff. So kind of watch yourself there. So when you talk about healthcare costs in retirement, this to me is a very challenging area. And this is where financial planners do bring up Medicare, but they bring it up in terms of a dollar figure. So I agree with some of these slides that talk about the average, $5,000. I kind of read that figure consistently per person for the next number of years of retirement. I think that number's a little bit low. If you had to, it's probably a good average number. The hard part is just today, I did a drug plan for a fellow who is estimated, his drugs alone for 2020 are estimated to be $4,900. So when you take that $4,900 drug charge for 2020, add that to his premiums for Medigap, his premiums for Medicare, and, you know, no dental, things like that, he's really at, you know, $9,000 to $10,000. So it's just very difficult. Medications are the biggest problem area for sure, along with dental. I will say dental, hearing, and vision are big holes. And then these things are very, very costly for people. So I don't have a good answer for how much you can fund into these things or prepare, but I can just say the highest I've ever seen out of pocket, I have two people that are taking one oral cancer drug, and it's $12,000 a year out of their own pocket. And that's a never-ending cost as long as they want to take that pill to stay alive, is what they tell me. So that's a hard thing to factor into your world. So again, just pointing it out, I don't have a great answer, but just know it's not free when you get here. A lot of people think it's free.
Yeah.
Was there a question?
No, where there was a comment, that's when they bust to Canada. When they got an ongoing drug habit.
We are Michigan borders Canada. We have Windsor right there, and we've got a fair amount of pharmacies that are 30 miles from my house, where in St. Clair Shores and Dearborn, where you can get Canadian drugs right at the border here. So that's a common actually conversation for us to have here with insulin and things like that. So absolutely. I know people that go to Thailand, to Tijuana, Cabo, all sorts of places to get creams. And
I met
what was
some
that?
high up in the Canadian medical industry, and they're worried they're not going to have enough for their own people because of all the Americans.
Yeah.
Wow.
Yeah. That was Trump's platform, was to take import from Canada to try it, I think, on Florida. I don't think it got any place, but that was an idea, which I heard the same thing. They're concerned that it would take all their sources away. And that could be true. Yeah, very challenging. Very, very challenging. So what do you do?
On silver sneakers, please.
What would you like to know about it?
I'm trying to match whether it's worth me adding it to my Medicare or just paying the monthly at the gym.
There's a couple ways to handle that. So United Healthcare for 2020 is coming back. They're adding something called Renew Active, or whatever they're calling the program now, but it's adding health club memberships to the people that have Medigap. They can get a free membership paid for. You know, LA Fitness, there's a whole bunch. YMCA's, there's a list online. If you want the list, email us, we'll send it to you. But you can, if you have United Healthcare as a Medigap, you can go to any of those and they will pay the fee. If you are just joining a Medicare Advantage plan to get the silver and the silver sneakers at no charge, I would just be very wary, because we have Medicare Advantage plans here that offer it 1 year, but I just got an email last night and he said now they're dropping silver sneakers. So they change plans a lot. So now it's going to silver and fit. So if you want to be chasing down your proper membership every year, you just have to be careful. Me personally, I would be paying for the membership even if I had to, and I would have better quality medical coverage. That's just my opinion. I don't see the value in a $20 membership that makes you change your medical every year and chase and jump through hoops and things like that. I would lean towards United Healthcare Medigap for a free membership.
Okay, how do I do that?
Do you have anything yet? Are you Medicare age?
I don't have Gap, but I do have Medicare. I'm 68.
Okay.
I have AB, PPO, and I have a backup of Horizon Blue Cross Direct.
Okay, so you'd be one of those, so you have the PPO. So right now is the time you can actually get underwritten from United Healthcare. And then once you get an approval, you get a rate. And then 2020, you can add your gym membership from the list of locations that we can send you. So you can just call us and one of our advisors can help you.
Okay, I can give you my email. That might be easier.
Sure.
Okay. We have another question?
Yeah,
Yes.
how do you find out what is better for you, either original Medicare or Advantage?
That's a great question, but it's again, it's not an either or. It's what is best for you. Am I right, Joanne?
Yeah, it's not one size fits all at all. We would sit and have a conversation because there are some people, honestly, that just say, I don't want to pay anything. Okay, there are zero premium plans. If you're going to get a Medicare Advantage plan, I would just suggest that you do it in a smart manner. We have other policies that you can pair with that, such as a cancer plan. You can buy a cancer plan for $25 a month or about that at 65, that if you got a diagnosis of any kind of cancer, we can have a carrier pay you $10,000. Well, that will help with your copays for certain things. So we have some people that say, look, I got a $50 a month budget. That's it. And some people want the best coverage they can have. And some people want freedom of doctor choice. And some people could care less. Some people are going to travel. Some people are going to live in Arizona for 3 months and elsewhere. Some are never going to leave their habitat at 5-mile radius. So there's just too many things to be generic about. So it really is just, it's kind of a simple conversation. I don't mean to dumb it down, but it's a conversation with one of our advisors. Just talk it through and you decide what's good for you, and if we can't help you in your location, we can either refer you to someone that possibly could or steer you back to a local person. If it's an Advantage plan, those are pretty localized. And I think you should know your local hospital, your local, somebody should have awareness of that. So we can have the conversation and help steer you towards what you want. And we know the questions to ask, things like that. I can detect in 5 minutes what's important to somebody with their health care and give them what I think they want. And it's up to them if they want to implement it or not. And if they don't want to, that's totally fine too.
Awesome. We have another question?
How can we contact you?
Great question. Now, if you look up here, you can see that there's boomerhealthgroup.com. So if you're online, just go to boomerhealthgroup.com. And Joanne, do you want to give a phone number?
Sure. Yeah, the general number is 248-871-7756. We have on the main website on Boomer Health Group, there's a chat feature. If you want to you can be clandestine. All we do is ask for a first name. You put in Tom and we start talking to Tom. Ask your questions. We don't hound with phone, we don't need your phone number. We don't need, anything. Another tip, when you're looking for a rate or a request for something out online, be careful because as soon as you put your real phone number in, your phone is going to blow up with agents calling you. Okay? It is.
Been there, done that.
Same with your email. You do a real email, you'll never get off those lists. So don't do that. So we don't do that. We have another good place, a resource that I should bring up. It's called the BHG. So it's Boomer Health Group, BHG Vault, BAULT.com.
Vault.
That is our website.
VAULT.com.
BHG Vault.
BHG Vault.
Yep.
As in a safe.
.com.
Right?
Yep.
Yeah.
Yep.
And they have great resources. You should definitely check that out.
It's free.
It's free.
And it's totally free, and you can sign up for little notices that once a month we'll send you something, but we will not bug you. But you don't need to, no phone numbers or anything like that, but it's just, there's a ton of information in there. There's videos, there's, you know, PDFs, there's everything you need to know about Medicare that we keep adding to is in that area. That's our site. And
An attachment of Medicare, right?
No,
what's that? I'm sorry?
It's part of Boomer Health Group.
It's ours.
It's theirs.
No,
It's just information.
not meaning Medicare.
Not me. No, it's their own information about Medicare.
Thank you.
You're welcome.
Right. Yep, there's some documents that link you back to the original Medicare site from the government. So we just keep it. There's like employer forms. There's all sorts of things you should know about COBRA. There's videos. There's just, there's tips on prescriptions. There's, you know, all sorts of stuff. Anything we kind of find about Medicare that might be useful, we kind of stick it out there for you. And there's no charge. And there's no charge to our phone calls. Again, we're paid by insurance carriers. We're paid just like your home and auto people. We represent all the carriers that we want to. We can always add more if we want, but you know, we don't care what carrier we use other than we use good carriers that aren't going to gouge you down the road from what we see historically. So, you know, we try and do what we can there. So.
Okay. Joanne, we have another question?
There's
Yeah.
like advertisements on TV in regards to, like she was saying before, Joe Namath or whatever. There's one in regards to New Jersey. I think it's Blue Health or Blue Horizon. For the medical advantage that
Yep.
pays back the Part B and everything. You don't have to worry about
Yep.
paying that. Is
Yep.
it true, or is that just?
No, they do that. They do that. We just found a veteran one here in Michigan. They pay $40 a month rebate for the Part B premium. Yep.
Okay, so it is a good option and everything, or?
It's legitimate.
It's still an advantage plan at the end. Yeah. At the end of the day, yes, it's legitimate, but they're just enticing you to get into the program.
Okay.
So always just sit back and just remember that the government is funding these fellows pretty heavily to get your business. So what does it mean to you? The questions you need to find out, if you're going to consider the advantage plan, look at if you need physical therapy, how much are you going to pay every time you go in the door? It's usually about $40. Make sure, and there's no way to make sure. If you need a knee replacement, are they going to cut you off after 5 sessions? Or can you have 28 sessions like regular Medicare will allow? And I'm just throwing a number of 28 out there. But there's no cap to physical therapy for Medicare. So we get questions like, well, I want to make sure I'm covered for PT. Like, well, what do you mean by that? Well, every time I go to PT, all these people are complaining that Medicare doesn't pay for it. No, Medicare pays very, very well for PT. The advantage plans are the ones that are not paying for the physical therapy. You're putting yourself into their rules. So you have to accept what their rules are. So I have no problem if somebody wants to accept that for $0. If you want to pay $0, you just need to understand that their rules are their rules. So you might fight the carrier, you might not, you might win, you might lose. I don't know, but it's just more of a risk, and you have to every year watch the documents and pay attention.
And if you have questions, you can call Joanne and her team, and they can run through all the contingencies, so you know if it's a good choice for you,
Right.
right? So you can determine the appropriateness.
Right. Sure.
Yes.
Can't you go to their websites and basically see a chart of what they cover and what they don't,
Sure.
right? So that we get the breakdown?
Yes, but but you know, you have to be really diligent, you know, because there are a lot of contingencies. You know,
It's
yeah.
I know what the advantage plan, so we were looking at that for my wife.
Mm-hmm.
And what happens is you have to basically stay within a strict area. Even though they may offer plans in other parts of the state or other parts of the country,
Mm-hmm.
if you're there and something happens to you,
Right.
you're up to people
Right.
basically. I've been running.
Right.
Right?
Yeah.
Yeah, plan, you have no problems. As to where you are, whatever that plan is, we got an end for her because with the premium difference between the G and the N, and money and everything else, it was a savings and a half there.
And there you go. And it's what's right for you guys, right? So and like I'll give you an example with my mom. Okay, when I started taking care of my mom, she was in pretty good health, but you know, she needed dental, she needed she needed glasses, she needed podiatry, Okay, and these are all things that are not covered under traditional Medicare. I brought her from Florida to come live with me, so it's not like we needed to like go to her doctors. So when my mom first came to live with us, an Advantage plan worked very well for her because she got her glasses and she got to go to the dentist and she got to get her feet looked at. So all the things that she needed were primarily covered by that plan, and it worked out well. But as her condition changed, it made a lot more sense to go to traditional Medicare, right? Because she no longer needed to go to a dentist and she no longer needed glasses, but she needed the extended care that was offered by a traditional plan. So, you know, you may, what you sign up for at one stage in your life, you know, in addition to the fact that these plans change every year, right? So, you know, it makes sense to, on an annual basis, review with professionals what makes sense for you now.
How many times are you allowed to change
All right.
plans?
What was that question?
How many times are you allowed to change plans?
Oh, you can change tons, 10, 20, 30, whatever you want. With Medigap, you have to be careful. It's like musical chairs. As soon as your health changes and you can't change any longer, you're done, potentially. But Medicare Advantage, if you wanted to change every single year for the next 30 years, you can do that.
Well, no,
They don't ask any underwriting.
What I'm saying is that if you're under Medicare, which is Medigap.
Yep.
And how many times are you allowed to change if you're in it like N or F or G or whatever the ones are? How many times?
You can keep going. You can keep going until your health changes.
Okay,
It doesn't. There's no limit.
Okay.
What do you mean till your health changes?
The question is, what do you mean until your health changes?
So when somebody wants to change Medigap, let's just say they get a Plan N and they just start, you know, thinking they want a little more coverage. They want to go to a Plan G as a girl. So when they come to us after they've had Plan N for a couple of years, they want to change. A lot of people assume, and largely because of the media, they assume that they can just call us in October, November and change to a Plan G. And it's not that simple. We're going to say, okay, let's get the underwriting questions out for Aetna, and let's see if you can answer no to all of those questions. If you can answer no to all the questions, you probably can have a policy, a Plan G with Aetna. However, if you just had a stent put in 3 months ago, you're not going to be allowed to move to any carrier based on that. So there is health underwriting, and a lot of people just don't understand the pre-existing conditions. Totally exists with Medicare.
And that's in particular with the Medigap plans.
Right. Now, it does not exist. So pre-existing does not matter with Medicare Advantage. Again, that's just a funding situation with managed care. So if you want Medicare Advantage, you can flip those plans every single year. The only thing you cannot have is end-stage renal disease, which is the dialysis factor. So Medigap is definitely, you're subjected to pre-existing condition problems, which is why in the outset, it's an important thing to look down the road, you know, for most people. If we have people that are coming to us that have, you know, I had a guy recently, I remember he had I don't know, he has to have reconstructive heart something because he had a pacemaker. I don't know what he had, but he's coming on 65 years old. So that's a really serious conversation that we're going to have. Just like, listen, in my opinion, you need Medigap. Unless you absolutely can't afford it, you need to have Medigap to pay for your surgeries, because if you don't get it now, I think there's a really good chance that you're never going to get it. Okay, so you are protected. So remember, if we get one nugget today, and when you're new to Medicare Part B, when you're brand new to Part B, you can be any age, but when you trigger and start your Part B with Medicare, that's when you have 6 months. You're totally protected to get any Medigap plan you want without any carrier or agent asking you any medical question at all. That's important. It's an important protection that just isn't advertised. It's more advertised that, hey, you can just change your plan next November just because you want to. No, that's not quite true.
That's a really great
That makes
point.
sense?
Thank you.
But if you have
Pre-existing conditions?
is that
Yep.
negative to you?
Is that a negative?
Yeah, right. It
Yeah.
is a negative because you have to go through
Yeah.
underwriting.
If you have cardiomyopathy, and I say, do you have, you know, in the last 2 years, have you been treated for cardiomyopathy? If you have it, you've been treated for it. And you're going to say yes. Then I'm going to say, I'm sorry. You know, you're not going to get accepted by this carrier.
But like in my particular case and everything, right now I'm covered under my husband's insurance, okay? I have stroke.
Yep.
I have AFib. I have sleep apnea.
Yep.
It's a mess. So are they gonna look at that and say, well, I'm sorry, we can't cover you?
Do you have Part B of Medicare yet?
No.
No. So there's your protection right now. So let's just say you stay on his health insurance. And this is where it's critical to just talk about it before 65, because then I would say, well, no, stay on his group plan. Stay on his group plan. And then now let's say you're 68 years old and he decides to retire, so your coverage is going away. Then you're going to call back and you're going to say, okay, now I'm ready for Medicare. We're going to walk you through how to go get Medicare hooked up properly. And then when you're 68 and you're brand new to Medicare Part B, guess what? You have your 6-month window where we're not going to ask you your health questions. But the AFib and the apnea are enough that I'm going to say, you know what? I would get Medigap out the gate because it's really good coverage. And who knows what happens 2 years after you've been on Part B if you could qualify to come back. If you chose Medicare Advantage first, you may not go back to Medigap. Does that make sense?
Yeah, you've got that you'll have that 6-month window where you won't have any underwriting concerns. Your pre-existing
Right. So they will not. Yeah, you're
factor in.
Yeah, you're protected because you're not on Part B yet.
Right.
But from the start date of Part B, that's when your clock starts counting. So what happens is the worst thing is when people make the mistake of just getting Medicare Advantage because they feel healthy, they feel young, they feel good, and then boom, 3 years later, something happens. Then they remember that, oh, you know what? I think Medigap is really good coverage. I want that now. Then you come poking around to get that from us. You can't have it. You know, like my guy yesterday, he's looking to change companies. His PSA ratings are high. He's having biopsy today. You can't have it right now. If he gets the all clear in 2-3 months, we can probably relook at that, but he can't right now. So there's just, again, our whole point is that there's a more to it than just the commercials flaring up there that are saying, change your plan, change your plan.
Yes.
Question and a longer one. Can I go to this Boomer Health Group to get the list of gyms that you mentioned?
I will send them to you. If you email me myself, if you actually go on there, you'll find my email. I'm Joanne. You can email Gwen or anybody, or you can even go on the chat function, probably easiest, and say, hey, I understand there's a United Healthcare link to check out gym memberships. Can you send it to me? And we could certainly give it to you.
I'll get her email.
And all you do is, that's fine. Just punch in your email. Punch in your zip code, and it'll pull up all the gyms in the 10, 20, 30-mile radius.
Thank you. The longer question is, 1 or 2 years ago, I'm a retired Bayonne school teacher. It appeared as though they were trying to force us into Aetna and take away our Blue Cross.
Wow.
Okay. I found out that I did not have to accept this, but they made me jump through hoops to keep my Blue Cross. I had to get paperwork from them, printed out, get it in by a certain date. Is that going to come down the pike again? Are they going to try it again or every year?
They might.
I mean,
I can't speak for the school system.
But I was happy with what I had.
Right. And I would agree. I don't know. I mean, there's so many changes to group retiree plans and such that they're just, racking up those copays and boosting things up. Retiree coverage is not what it used to be 10, 15 years ago, even. It's getting worse. So they have the ability to change that every year. Absolutely.
Yeah. Well,
yep.
The issue is they were very, very, they lied. They pretty much told us we had no choice. We had to accept Aetna. And that wasn't true.
Well, that's no surprise. That doesn't surprise me at all. Yeah. No, it doesn't. They can do what they want, and they're not going to, there's some reason they don't. It typically means that they're getting a better deal with Aetna, and they're funding a lot with Blue Cross. They don't want you to know that you can stay with Blue Cross because you're costing them a lot of money.
Yeah.
And they have obligations from 20, 30 years ago that they don't really want to fulfill anymore.
And we're living longer.
Yeah, absolutely. That is a huge problem. sad to say. It's a huge problem. Yep.
Joanne, we have another question?
Yeah.
Part A covers everything when you're in the hospital, admitted into the hospital,
Mm-hmm.
okay? Part B is the doctor.
Yes.
Now, let's say you end up in a hospital, right? You're on Medicare. Now, my understanding, there could be two types of doctors who accept Medicare, or two types. There's one that will accept whatever Medicare gives them. There's another one that says, well,
Yep.
we want additional, right?
Right.
Now, you have no way
Yep.
to meet the hospital. Look, we only want to be treated like people who would accept Medicare, period. New Jersey has a double billing thing now. A double billing law they passed last year.
Uh-huh.
You familiar with that?
Joanne, you familiar with the double billing law in New
Well,
Jersey?
there's balance billing, right? There's balance billing,
Well,
right? With excess charges as Medicare.
The carrier, right? Let's say they go to
Yep.
bill and they accept their charge. They can't turn around and bill us. What I want to know is
Right.
the difference or anything like that. My question is.
Yeah, there is.
Is that
So
correct?
with Medicare, with Medicare, you have to be careful on your Medigap side is more protection against that. So yes, there are two types of doctors. One participates with Medicare, one is non-participating. It doesn't mean that they won't work on you or be a surgeon or something. It just means they have different structures and what they'll accept and what they won't. The non-participating doctor, yes, can turn around and bill you, the client, 15% is the cap. So they can bill you up to 15% of the charge. They accept less than Medicare is going to pay, and a little bit less, 5% less, and they turn around and bill you. If you buy a Medigap contract, if you buy a Plan G, a Plan F, they will pay that for you. So you will never be stuck with a balance bill situation. If you get a Plan N as in Nancy, you will pay that. So Plan N does not cover the excess charge bill. Then Medicare Advantage, it depends on the carrier, the balance billing situation. So that is not as easy as to speak to, but there is balance billing situations sometimes with Medicare. You don't see it very much. You really, really don't, a couple % of the time. But that doesn't mean it can't happen more in, 3 to 5 years to 10 years. Who knows?
Okay, thanks for the question. Nick?
Are you gonna lay out, like, just basically how to sign up for Medicare?
Ah.
How do you sign up? What was the question? How do you do it?
Yeah, how do you sign up for Medicare?
Yeah. So when somebody, if they're coming up to 65 years old and you're not collecting Social Security, remember that's the only time you're going to be automatically enrolled. If that's not you, so then let's say you need Medicare at 65 years old. You just know you have to get Medicare. That's your next step. If that's the case, just go online. We have a little tutorial. You can ask us to send you the tutorial. Just signing up online. It's much easier. I would suggest always staying out of the Social Security office if you can, because they give you poor advice with Medicare. They do. They give you bad advice with Medicare because they're not Medicare. They're Social Security. All right. So that's a big distinct difference. They sign you up for Medicare there. They collect the premiums for Medicare and that's it. But they will give wrong advice when you ask a question, and they really just shouldn't say anything, but they do. So just, again, don't go in the office. I would go online and do it, and it's pretty easy to do that. If you are on work insurance, however, so it's different now if you're now 67 and you've been working and you signed up for Part A a couple of years ago. Now when you need your medical part for Part B, you have a whole set of, you need another form. You need 2 forms to go into the Social Security office. Unfortunately, we got to send you in the office at that point. But that's how that part works too. So there's just different rules even in the how to sign up, because that's what's funny with Medicare. Someone just says go sign up. Well, what does that mean? Go where? Go what? Go do what? So we coach people through that part. As dumb as it sounds, go sign up is just not that easy. So even paying for Medicare is not that easy. Well, how do I pay for it? If you're not collecting Social Security, you send in a check or you have a credit card. They pay, they bill you quarterly. Things like that. If you're getting Social Security, they're going to take it out of your check. So it's just funny that dumb little things like that are seemingly dumb little things, but they're important, right? Well, how do I pay this bill? What do I do with it? Do I have to pay for it?
Okay.
Yeah. It is comical.
Okay.
Collecting Social Security, I'm turning 65 in March. Will they automatically send me my card in December?
Yes.
And they'll send me
Coming up, yeah.
the booklet?
Yeah.
So I don't have to do anything. I don't have to go anywhere.
Right.
They're going to send it to me.
No.
3 months.
Right, yours is going to show up on your doorstep. Yours is just going to appear, and it's going to have a Part A effective date and a Part B effective date of March 1st. Now, the difference is, do you need Medicare in March 1st? Is Medicare your next stop, or are you still working or on somebody else's insurance?
I'm retired, but I have my
Okay,
doctor's insurance, which I'm paying for now, will be my secondary. Medicare will
Okay.
be primary.
okay. So then the retiree plan will tell you that you just have A and B, and that's your setup, so you're good. If you were still working and you didn't need Part B, you would have to know to take the card that you get and defer Part B. Just say, no, thanks, I don't need it right now. But you do need it right when it comes.
So it would be smart to take Medicare Part B and then my carpenter's insurance as my secondary.
I think the MERS insurance is going to require you to do so. You should get notification from them that you have to have A and B in place with the retirement plan.
Yeah, my carpenter's insurance says I have to go
Yeah.
on that.
Yeah.
Yeah, 99% of retiree plans require A and B in place, and they should tell you that and get, copy of your card and things like that.
Okay, so they will send that to me in the mail.
Yes.
Yes.
Okay, thanks.
Question, I'm a veteran,
Yep.
I'm not retired, I'm not collecting Social Security. When I turn 65, do I have to worry about Part B at that point in time? Because I use the VA for 100% of my medical?
I'm sorry, can
Okay.
you repeat the question, Tracy?
Sure.
Closer to me or?
Okay, so the gentleman he's not yet retired. He is a veteran, and
Uh-huh.
VA is paying 100%.
I
Nope,
take care of 100% of my medical,
the VA takes care
Okay.
of 100% of his benefits.
right? Do I
Okay.
worry about Part B when I turn 65?
Does he need to worry about Part
Oh, that's a great question.
65?
Great question. So that's a fascinating question because you don't technically have to get Part B. However, I would get Part B. And here's why. And we have a veteran today that we just wrote a plan on, a new Advantage plan. He's the one getting the $40 credit for Part B because we do advocate getting Part B, even though you have 100% of your services at your VA facility. But there was just an article of down in Georgia, a VA hospital just decided to suspend surgeries for 3 months for some whatever reason. You're always going to be subjected to possibly that kind of stuff. And it may never happen to you. It might happen to you. The thing is, if you want to come outside of the VA ever, if you decide in 8 years that you wanted to start poking around outside of the VA system, if you got ill with something, you could go then get Part B, but then you're going to be in for a penalty of 7 or 8 years of not having it.
Right, and then it would be subject to the questionnaire for the underwriters?
No, you wouldn't. You would, because what happens is you would go to approach the government and say, hey, I want Part B now. I didn't want it before. But the penalty is 10% a year for every year you don't have it. So all of a sudden, let's just say it's 7 years. Now you got a 70% penalty on top of your base premium. Then you can have it. You're just going to pay a pretty good premium for it. Then you can turn around and still get Medigap to cover pre-existing. So you're safe there. You're just going to be penalized a lot. I just like Part B added and with a zero premium Medicare Advantage plan for if you want to step out of the VA. That's just my own personal opinion because I don't know. And you're in the VA system, not me, but I would just be cautious. But I have veterans too that just don't want Part B, and that's okay. That's up to them. But I would tend to get Part B. And a zero premium plan, making that really clear.
The Medicare Part B, they take $144.60 a month out of your check. Is that correct?
Yes.
Yes, it is.
That
Starting
comes out of your
January
Social
1st.
Security.
Right.
Yeah.
Okay.
So what is,
Yep.
up to 144.60 now?
144.60.
That's the 2020 increase rate.
That's 2020 rate.
Last year was like
Yeah.
135, right?
Yeah.
And
I
the
know.
mistake I made when I started getting the Social Security check is I didn't realize that they don't take out any taxes. You have to regulate that. And I got hit. Whoa.
Yeah.
My CPA told me that.
Mine didn't.
So it's going up to 144.
144.60.
$99 increase,
Mm-hmm.
60.
Yeah.
They might throw
What?
you $1 above them.
And deductible for Part B is going to 198 now.
Right.
2020.
What?
Part B is going up to 198.
No, G.
The deductible for Part B is going to 198.
Yeah,
Currently,
the
it's 185.
The deductible for Part B is 198.
Right. Welcome to retirement. It's free.
Everything's great. It's the golden age, right?
Everything's free. Right.
Okay. So, guys, any other questions?
Yeah, you say the deductible is 198. What does that mean exactly?
Okay.
It means so if somebody just had Medicare Part A and Part B alone as their insurance, and that's possible too. You can have just those two components, nothing else, and they needed doctor services, their deductible is $198. So they pay the first $198, and then they would have 20% copays on everything going forward.
Okay. Okay.
That's it. See, we could go on for 4 hours with this stuff.
Yeah, no doubt, no doubt. So was this helpful?
Yes.
Okay, wonderful. Well, I would like to thank Joanne and Gwen for hanging with us today and the fabulous overview of Medicare. And I thank you guys for coming out and challenging the weather. And if you haven't given me your information, I would really appreciate it if you would, because I got 4 people who did, and I know there are more than 4 people here. So,
Another page. There's other pages.
oh, is there?
Yes.
Didn't see. Okay.
No.
Okay. Well, we will get that to you.
Thank you.
You're welcome. Okay. So, if I could ask, would you mind showing some appreciation for our friends? Thank you. Joanne and Gwen, I'm going to be sharing your email address
Sure.
with some people who want it. And thank you so much for joining us today. I think this worked out pretty well, huh?
Yes, very good.
Okay, wonderful.
Good.
And
Well, it will be recorded. So remember, you can do what you'd like with it too, being recorded.
yes. So and for those of you who give me an email address, once the video is available, I will share the link with you guys. You can again, and you can share it with friends. Okay.
This thing.
Yes.
Thank you.
What we did here today. You're welcome. Thank you.
Thank you all.
Yeah.
Okay. Thank you so much. Yes, yes, I will do that.
Thank you.
All right. Okay, so Joanne, I'm gonna sign off and
I'm just gonna stop the recording and sign off.
okay, great.
care.
Thank you so